Hello out there, Denture family. It's me again. How are you all this wonderful, wonderful Sunday? The last Sunday in June. Wow, can you believe this year is half over already? Wow. And so many things have been going on this year, from getting my health back to getting these new babies in 2 months. I'm just over 2 months past my extractions and immediate dentures. So this is how it goes. Anyway, I wanted to talk to you guys today about gum disease. That is, I don't know the numbers, but I would guess it's probably one of the highest causes of having to get dentures at a younger and younger age, especially nowadays. For some reason, even though a lot of us are focused on dental health and we brush our teeth, some of us brush our teeth regularly, 2-3 times a day, and we floss and we do everything that the dentist tells us to, and yet we still get hit with gum disease, and also known as periodontal disease. And what periodontal disease is, it's an infection of the tissues that hold your teeth, your gums. It is normally caused by poor brushing and flossing habits. That it allows plaque. The plaque is a sticky buildup of film, of bacteria that gets on your teeth. It builds up and it hardens. And what happens is when you get plaque on there and you don't brush regularly, you don't get that stuff off, that the only way you can get that off is to go to the dentist and they have to scrape it off. Ow. Just the thought of that really hurts. But in advanced stages, periodontal disease leads to sore and bleeding gums and painful chewing problems and even tooth loss, hence having to get dentures. Gum disease is one of the reasons that I lost my teeth. I had gum disease probably in my early 20s. I had a dentist tell me at that time that I needed to go every time I ate something, whether it's snacking or meals or whatever. I needed to go immediately within 10 minutes of eating and go brush my teeth immediately. And of course, I was 20 years old and I thought I knew everything, and I didn't do that. Still brush my teeth pretty regularly. Missed a few times, missed a morning or missed an afternoon or, whatever. But anyway, as it went on over a 20-year period, the bleeding gums would get worse and the gums would start receding, and hence now I have to have, at 53 years old, have to have a full set of dentures. What causes it? Well, our mouths are full of bacteria. And that bacteria, along with our mucus and other particles constantly form a sticky stuff called plaque that gets on our teeth and hardens. Brushing and flossing will help get rid of plaque, but when it's not removed, it can harden and form tartar that brushing doesn't clean. And I see a lot of toothpaste out there that call themselves tartar control. I don't know if that's accurate or not, if they actually do prevent tartar from building up, but it doesn't hurt. But at that point, when it gets to that point, only a professional dentist or hygienist can remove tartar. Other risk factors can include stuff like, obviously, poor oral health habits, but smoking and chewing tobacco can increase your risk. Older age. As we get older, I don't think I know of anybody in their 70s or older that don't have dentures. If they do, I don't know. If they don't, I don't know. Hormonal changes such as pregnancy and menopause can increase your risks. I've had 5 pregnancies, so hence there's a double whammy there. And when you delve deeper into it, I get triple whammied and quadruple whammied. But substance abuse can also lead to advanced periodontal disease. And we have obesity can also lead to that. Obviously, if you're obese, you're in poor health, and a lot of that plays in the factors of developing advanced gum disease. Inadequate nutrition, including a vitamin C deficiency. Now, with the mainstream American diet of convenience foods, processed foods, fast foods, we all eat a very poor diet. Very low in nutrients and very high in things that it shouldn't be high in, such as sugar. And you'd be surprised at what they add sugar to nowadays. But also genetics. My mom had advanced periodontal disease, and I remember when she was in her 30s, she had to have surgery on her gums. And of course, she's now 74 years old and doesn't have any teeth. My grandmother on my mother's side also had advanced periodontal disease, and I remember her having surgery and getting very sick at one time and being in the hospital because it had advanced so much that it got down into her throat and caused an infection there. There are certain medications that can cause dry mouth and gum changes. So when you get a prescription from your doctor, ask him if this can cause dry mouth and if one of the side effects is tooth loss or gum disease or anything like that. At any rate, let's see, conditions that also decrease your immunity, such as leukemia, HIV, and cancer treatments. Anything like that can reduce your immunity, which helps fight off that bacteria that's in your mouth, and that bad bacteria that builds up obviously can cause problems with that. Now let's get into symptoms. Symptoms, bad breath that just won't go away no matter how many pieces of gum you chew, breath mints you take, mouthwash you use. Bad breath just won't go away. Red or swollen gums, bleeding gums, very tender gums obviously are a sign of gum disease. Painful chewing, it hurts to chew. Loose teeth. I remember with mine, my first tooth, this one right here, it was my first tooth I lost. And it got loose and it got to the point where it was actually jutting up above the other teeth, and it was obvious that there was something wrong with it, and you could literally just wiggle it back and forth until it finally came out. Receding gums or teeth that are appearing longer than they used to. So obviously, as your gums are receding, you're losing gum, you're losing bone in your jaw, because that's one of the side effects of having gum disease is that you lose the bone in your jaw. It holds on to your teeth. Okay. There's several different types of periodontitis. The most common types are, of course, chronic. It's the most common type. Affects mostly adults, although children can be affected too. Now, I have a 17-year-old son, and he has got the early stages of periodontal disease. The dentist told him at this point he's at the stage where it is reversible, as long as he maintains and is on top of brushing his gums, brushing his teeth, brushing his tongue. And doing that, make sure you're brushing your entire mouth. I'm talking about your lips, your gums, your palate, your tongue, everything. It's generally caused by plaque buildup and involves a slow deterioration. Mine deteriorated over a 20 plus year period. It may improve or get worse over time, but it causes destruction in your gums and bones and the loss of teeth if it's not treated. Aggressive periodontitis usually begins in childhood or early adulthood and affects only a small number of people. So that's one that's not so common. It tends to affect families and causes rapid progression of bone and tooth loss if it's left untreated. And the worst one, necrotizing periodontal disease, is characterized by the death of the gum tissue, tooth ligaments, and the supporting bone caused by lack of blood supply, also known as necrosis, resulting in severe infection. This type generally occurs in people with a suppressed immune system, such as from HIV, cancer treatment, or other causes, and malnutrition. Obviously, you need those nutrients in your body to help fight off those infections. Anyway, obviously, to get diagnosed, you have to visit a dentist. That's pretty obvious. But if you don't have dentures already, and just because you have dentures doesn't mean you don't need to take care of your gums too. Examine your gums every day. Note any sign of inflammation. Obviously, if you've still got your teeth, they have a tiny ruler called a probe that you can check for and measure pockets around your teeth. In a healthy mouth, the depth of these pockets are usually between 1 and 3 millimeters. The test for the pocket depth is generally painless. So, anyway, medical history, identifying conditions or risk factors. Just think about that: smoking, diabetes, family history of gum disease, all that fun stuff. When you go to the dentist, they'll probably take an X-ray to see whether or not there's any bone loss, or refer you to a periodontist. Periodontists are experts in the diagnosis and treatment of gum disease and may provide you with treatment options that are not offered by your dentist. If you're letting it get as bad as I did, you're just pretty much screwed, and you're just going to have them all pulled, like I did. Most general dentists, if you have any teeth that are salvageable, they will try to save them. I think, though, that I know many people have spent thousands upon thousands of dollars trying to save teeth and doing everything the dentist told them to possibly save every tooth they possibly could in their mouths, but and still end up having to pull them. So it's your mouth, your money. So you decide what options are available. Depending on what options are available, you need to decide what route that you want to take in that process. Obviously, the treatment is to control the infection. The number and types of treatments can vary depending on the extent. You could have anything from what's called root planing to, I don't know, bone grafting, that kind of stuff in order to prevent. Now, if you're about to get extractions, let's say you've already gone to the dentist, you know you've got gum disease, you know your teeth need to come out, you've already gone to the dentist, make absolutely positively sure that before you have those extractions that you have got your prescription for your antibiotics. Because what can happen is when they pull those teeth and there's infection pockets in there and they're full of infection, you are at much higher risk of that infection getting into your blood and causing sepsis throughout your body. I know one person I can think of just recently who his dentist did not give him antibiotics, and he ended up in the hospital with a massive infection and on IV antibiotics. There was another person who told me that just recently they had somebody else that was in ICU. They were in ICU for another reason, but they had someone else in there they had just died due to a massive infection in their gums that got into their body and killed them. It's called sepsis. So make absolutely positively sure that when you go to that dentist before your extractions, you get your antibiotics and start them at least 24 hours before. And I made absolutely sure I got mine, and I started my antibiotics the day before just to make sure. If I don't think I had any infection, you never know for sure. Sometimes you can have an infection that you don't necessarily have any symptoms for, but it's in there and there's no way of knowing for sure until after. And you don't want to find out too late that you had a massive infection and it got into your bloodstream. And you have to go through being hospitalized at times, massive antibiotics, IV antibiotics. It's a really rough road, and it's a road you don't want to go down. So I highly recommend that you get that treatment. Get those antibiotics, okay? Anyway, if you have any questions, any concerns, anything you'd like me to touch on in the future, please leave a comment below. Hit the subscribe button over there. I had to think for a minute. Hit the subscribe button. Click the little bell thing beside it so you get notified anytime I have a new video posted. Don't forget to check out my giveaway video. Once I get to 200 subscribers, I will be doing a giveaway of the entire Dr. B's Dental Solutions kit, which includes the Sonic Cleaner, the Adhesident, the Cleanadent, and the Cleanadent crystals for the Sonic Cleaner. And it comes with batteries too. Yeah. Although the batteries only lasted me about 3 weeks because they're the generic kind, but that's okay. Because I always have batteries in my house. Because we have remotes and that kind of stuff that we need batteries for. So hence we have batteries always around the house. Even if I have to go steal them out of my remote to go put them in my Sonic Cleaner, I'm going to get them done. That stuff is absolutely amazing. I highly recommend the Adhesident. I highly recommend the Cleanadent. It really does work on getting that stuff off your gums. And those crystals, man, you brush your dentures. You take them out, you brush your dentures, and you think you're getting them clean. Then you put them in that Sonic Cleaner and turn it on for 20 minutes. You take your teeth out. Oh my gosh, the stuff that comes out and it's on the bottom of there, it's like brushing your teeth. You don't necessarily realize they may look good on the surface, but you don't realize what you've left in there. Anyway, that's all I got for today. You guys have a wonderful day. God bless, and I will see you next time.